Welcome, everyone, to the first episode of Season 5 of Doc Talks with Dr. Forrest, Tennant, and Friends. We're so glad to have a new season, a new year, a new chapter in life, and we're looking forward to tonight. We also have a great guest with us, and so we're looking forward to having a great time together. Thank you so much, Dr. Tennant. It's all yours. Take it away. Thanks so much.
Thank you, Jamie, and I too want to welcome everybody here to the first show of 2025. We've had a great year in 2024. I know people are starting to learn a lot, starting to get better help, and we want to continue this trend forward. Dr. Ibsen and I have conferred in the last hour or two, and we've got a few strong opinions on some things, which you'll hear about in a few minutes. Perhaps it was just the end of the year or first of the year, but my mailbox has not been pleasant this last week. I've got some things that I want to bring up before I bring up some good news. The first thing I want to bring up is there's something called the AARP Bulletin. Now, some of you may belong to AARP. Do I personally do. It's a Medicare provider, and so it's tied with the government. And it does tend to mirror a lot of their opinions and their views. But one thing struck me that I wanted to call to your attention. They have an article in the AARP latest bulletin. It says, ask Dr. Adam. Now, what this article is, it says you shouldn't be taking multiple vitamins. Okay. Now, I'm going to read you a sentence or two here. And it says, the vitamin supplement industries are enormous. I don't want them to get annoyed with me, but the reality is that if you eat a well-balanced diet with fruits, vegetables, protein, dairy, and whole grains, you don't need to take a multiple vitamin. This has been proven over and over again. Well, I don't know where it was proven, number one. And I know one thing. If you're a pain patient, you don't have a good diet. Why? Chronic pain alters your endocrine system, it alters your bowels, it alters your digestive system, it alters your metabolism, your insulin. And so therefore, people in pain, frankly, most of you don't like to eat. And if you do eat, it tends to be high carbohydrates, low protein, because protein kind of tastes awful. And you're going to sleep in irregular hours. But the worst thing is that pain, chronic pain, drives out of your system all kinds of vitamins, enzymes, hormones. In other words, it alters your body. Now, they don't mention chronic pain in this article. All right? And my point that I want to make here is this. In my opinion, and I want to make this real clear, this program is primarily directed at people who have had pain for over 90 days and have to take medications every day to relieve it. In other words, true, serious chronic pain patients. If you're a true chronic pain patient, you need multiple vitamins. My first recommendation to you, go down and get to Walmart, go to a vitamin shop, go somewhere, get you a good, inexpensive, multiple vitamin mineral capsule or tablet and take it every day. In other words, these articles, I don't know whether their intent is to really be helpful or not. All I know is they don't make any exceptions for anybody. It's just don't take a multiple vitamin. Now, this is the same publication that a few months ago said we have new research in pain that'll cure your pain. It's called Mindfulness. No, they didn't mention anybody who had severe pain over 90 days with severed nerves, arachnoiditis, entrapped nerves, central pain. They didn't mention any of those people. It's just that mindfulness is going to cure you. And now don't take a vitamin. In my opinion, take those vitamins if you're a chronic pain patient. Now, the next one I got is something called Pain Medicine NOS. Now, you're probably not familiar with this, but you should know about it. Pain Medicine NOS is the publication of the pain specialist. All right? Now, every time they send this out, So the so-called pain specialists of America, they are against opioid treatment. They're against medical treatment. Now, in this latest edition, now here's what they're telling all your doctors, all your therapists, all your physical therapists, your chiropractors, your NP, your PA. They're telling you that the way to get treated for pain is psychological treatment. Now, the lead article is called Mindfulness, Meditation, and Placebo Modulate Distinct Neural Signatures to Reduce Pain. Okay. Now, you turn the page, and their next article now for your doctor, remember, your pain specialist, he's going to see this. Emotional awareness expression therapy shown to curb pain severity. Now, I could go on through this whole magazine and give you another 3 or 4 articles that fundamentally say, don't take opioids or don't take medicine for your pain. Now, let me tell you what's wrong with this. And I just happened to catch a little notice about another new supplement or drug that might be doing something. Here is the problem with all of these articles, and I want everybody to bank this one. They never separate pain. Okay? Now, we've got millions of people with chronic pain, but do you have daily pain? Do you have what I like to call high impact pain? I like the word intractable because there's a certain kind of pain that drives up your blood pressure, reduces your adrenaline, alters your insulin levels, alters a lot of your hormone levels. And certainly today, these new MRIs can pinpoint right on down into your spinal canal, telling you what's wrong there with your arachnoid membrane, with your cauda equina, with your cord. We've got all kinds of interleukin tests. We've now got viral tests. We can actually determine whether somebody has tissue damage inside the body. Now, these studies that they're talking about here, okay, they don't tell us what kind of pain patients they're talking about. Now, are these people that got a bad bunion? They got a little carpal tunnel syndrome? Maybe migraine once a month? They all pull them together and call them chronic pain, then do the study and give you the outcome. Let me tell you, they're not going to get by me. I want to know, were those intractable pain patients with altered high blood pressure, altered hormone levels, altered vitamin levels, or were they just the ordinary chronic pain that all of us get when we get to be 50 or 60 years of age? Okay, they've got to be divided, and until we get this, forget it. Now, the other thing I want to make a point about, I don't know why anybody believes this. Psychological therapies have a place. I've known some great, and I know some great pain psychologists. They'll help teach you, adjust to your plight. They'll help motivate you. They'll help bring you some relaxation. And a little mindless therapy certainly helps you get through the day. But let me tell you what it doesn't do. When you have got nerves glued together, if you've got pudendal neuropathy, that means small nerve fibers are gone. If you've got RSD or CRPS, chances those long nerves are entrapped in fascia. If you've got daily pain, constant there, that means you've wiped out some receptors in your central nervous system. Psychological therapy does not bring back those receptors. It does not remove those adhesions. It does not bring back those nerves. They are fraudulently telling people that they can deal with physical anatomic tissue damage. You got that? They're saying psychological therapies can damage physiological anatomic tissue damage. That's not true. Now, we don't know how to repair most of those tissues. And if you are going to repair them, you're going to need nutrition, you're going to need hormones, you're going to need peptides, you're going to need diet, you're going to need physiological boosts that the body might generate to help cure you. But you're not going to do it with mindfulness. Okay? And so I don't know where they're getting this idea, and I don't want anybody out there in the real world, you know it anyway, thinks that some psychological therapy of any kind is going to take care of your adhesive arachnoiditis or your CRPS or your pudendal neuropathy. It's not going to happen. So that's why we're doing this show, to bring to bear that when you hear all these studies and you hear all these acclamations and all these support things that this treatment's doing it, who'd they test? Let's see the studies. Let's see the evidence. And it's out there. It's not hard to do, but the big problem is that they never like to separate pain patients. They never like to separate the terrible, intractable pain case from the routine chronic patient. And so consequently, most of you watching this show fall into what I call my serious pain candidate or patient, and that is those of you who had daily pain for 90 or more days, and you've got to take some kind of medication every day to keep it under control. Well, my mailbox still had another one coming. I love the Wall Street Journal, because once in a while it comes out with something that's awful. Front page. United Health's army of doctors helped it boost Medicare payments. Front page, Wall Street Journal. What the Wall Street Journal did was find out that United Health, and it was kind of stimulated by the murder of their CEO, found out that literally billions of dollars are being billed to Medicare because Medicare, the health plans are telling doctors what diagnosis to use. And as a matter of fact, the fraud, the scandal, is that they went out and interviewed doctors and found out that these health plans sometimes would have some operative walking the halls and giving doctors the diagnosis before they ever saw the patient. Okay? Now, I get MRIs from people all the time who say they can't get a diagnosis. Why? You've got an element out here. Now the insurance companies are telling the doctors what the diagnosis has got to be because they get more money for certain diagnoses. And I hear all the time that people just can't get a diagnosis of their pain problem. And here's another reason why. Ignorance of doctors is one thing, busy doctors are another, but this is also going on all over the country, and that's why it made the front page of the Wall Street Journal and why taxpayers are paying for this and patients aren't getting the proper diagnosis. Incidentally, this article goes on to talk about how a lot of doctors are not working for these insurance companies anymore because they've just decided they don't want to put up with that kind of stuff, and they're going into practice and knowing full well they're not going to make any big bucks. Okay? And maybe that's a good trend. It's a good trend. At any rate, a couple of 3 weeks ago, to tie in with this, I presented some information about how there's an unnecessary back surgery being done in this country every 8 minutes. Now, Medicare has published that 200,000 of these backs were operated on unnecessarily in the last 3 years, costing several billions of dollars. And I've been looking at records lately, and I'm sad to say that an awful lot of people are having back surgery, but they're not being given a diagnosis. And Medicare has come out and said a lot of these back surgeries are being done without any neurologic damage, no MRI showing that the discs are pressing on the spinal cord. They're doing these things without any of these symptoms that have traditionally called for surgery. In other words, we do need surgeries on backs, but the normal things has been paralysis affecting a leg, an MRI showing that your spinal canal is being compromised, and that you have intractable pain. Well, those things are being rejected, and apparently doctors, some surgeons are telling people, oh, you need back surgery, but they're not telling them why their discs have slipped. They're not telling them why their spinal cord is being compressed. Just surgeries are being done, much less all the epidurals. I'm going to talk about this in a few later shows, but the number of surgical procedures being done on a lot of people with arachnoiditis is absolutely unfathomable. I'm talking about 10 surgeries on the back. I'm talking about somebody who has had 24 epidurals. I can't believe some of these things. The bottom line is I'm sending out my first bulletin of the year, and it's called Just How Common is Adhesive Arachnoiditis? Now, when this century started, and even today, adhesive arachnoiditis is considered a rare disease. It's still listed on the rare disease ledger. And now I'm starting to wonder just how common is adhesive arachnoiditis. With all of these unnecessary surgeries being done, all of the diagnoses being avoided, I'm now starting to wonder maybe adhesive arachnoiditis is not a rare disease anymore, but now it's getting to be somewhat maybe common. I can't tell you this, except I know one thing. And before we interview our fine guests, I want to read you something. We have discovered that if you have adhesive arachnoiditis, you have at least 4 of 7 major symptoms. Okay? We've never seen a case less than 4. So I'm going to read you the 7 major symptoms of adhesive arachnoiditis. And if you have them and you haven't been diagnosed, or you have a friend, or you want to give your doctor a tip off, but if you know somebody who has a lot of these symptoms, they need to be evaluated for adhesive arachnoiditis, because that's the big gorilla in the room. Nobody wants that disease. That's the worst of the pain diseases. So let me read you these major symptoms, so you can learn them and pass it on. Number 1, in addition to chronic pain, do you ever experience sharp stabbing pains in your lower back when you twist, turn, or bend? Number 2, here's a biggie. Do you ever experience bizarre skin sensations such as crawling insects or water dripping down one or both legs? Water or insects on the legs is adhesive arachnoiditis until proven otherwise, folks. Number 3, do you ever have burning pains in your feet and or your groin crotch area? Number 4, does your pain temporarily lessen when you stand or recline? Number 5, do you have leg weakness and or pain that radiates down one or both legs? Number 6, here's another biggie. Do you experience any bladder dysfunction such as dribbling or difficulty when starting or stopping urination? And lastly, do you sometimes have a headache, dizziness, or blurred vision? Let me summarize this. I want to boil it down to 2 major symptoms. If you've got severe chronic back pain that's been there over 90 days, and you've got to take medicine for it, and number 2, your urination has been affected, you've got adhesive arachnoiditis until proven otherwise. Okay? And thirdly, if you got those insects or waters dripping on your legs, you start your medicine. Don't even wait for an MRI. Get started with treatment, because if there's one thing about these terrible pain conditions, the earlier we can make a diagnosis, the earlier we can get you into treatment, the better outcome you're going to have. Okay, and now I often promise that once a week I'm going to give you an EpsteinBarr quick lesson. I'm going to give you a 30-second EpsteinBarr lesson. I have in front of me a laboratory report from Life Extension. If a doctor doesn't want to order your EpsteinBarr test, or your nurse practitioner doesn't want anything to do with it, or your pain clinic tells you to go to where, you can order your EpsteinBarr test from Life Extension, and you won't need a doctor's prescription. And they do a 3-panel test. I'd like to see a 4 or 5 panel, but 3 will do it. And you can get it from Life Extension. And they subcontract with LabCorp to do your EpsteinBarr testing. Now, what I want to read to you, and it's a big misunderstanding, and you're going to hear this over and over in the first part of 2025, because there's no message I can give you that's more important. Let me repeat that. There's no message more than the one important than the one I'm going to give you right now, and that is how the laboratory reports your test. Doctors totally don't know how to interpret this, and you patients don't either because you haven't been taught, but we're going to start right now. Now, this happens to be a test on a patient with adhesive arachnoiditis and about 6 other pain problems. And his EpsteinBarr tests are this. He's got what's called the VCA, and he's got the eBNA. Those are the 2 big tests you got to have. They're antibody tests, okay? And here's how, and his are so high the laboratory couldn't even measure them, okay? They're greater than 600 each. Now, but here's how the lab reports this out. And it says, results indicate infection with Epstein-Barr virus at some time, however, cannot predict the timing of the infection since antibodies to eBNA usually develop after primary infection. Now, doctors are taking that statement, and nurse practitioners are taking that statement, and patients are taking this statement to mean everything's okay. Nothing could be further from the truth. These levels may be 10, 30, 50 times higher than normal. All the lab is telling you is all they can tell you, and that is you've had the infections or the reinfections, the reactivations sometime in the past. They can't tell you whether it was yesterday, last month, or 20 years ago. As a matter of fact, most people who really get sick with severe chronic pain have one reactivation, just like herpes. It goes away. They have another one, they have another one, they have another one, and the antibodies build up. Here's the catch. Here's the catch. One of these measures of antibodies is partially autoantibodies. What does that mean? You have autoimmunity for life. Now, an autoantibody is a little protein that floats around like Pac-Man, chewing up your tissue, eroding your tissue, making your nerves disappear, making them get inflamed, making them have adhesions. It's the big daddy. It's the gorilla in the room, okay? And so Epstein-Barr autoimmunity is still there, despite the fact that the virus may no longer be active. So one, and here's my lesson, the Epstein-Barr virus and some of the others, herpes 6, cytomegalovirus, probably COVID, what they do, once activated, may develop autoimmunity. And even though the virus is put to bed, the autoimmunity remains eating away at your arachnoid, your cauda equina, your pudendal nerves, and continuing to deteriorate your system. And the treatment today, it's new, has got to suppress that autoimmunity. Okay? So remember, the laboratory report only tells you what happened, not what it means. That's the doctor's job. Okay, we're going to move on with that. I'm sorry that some of that's not pleasant news. I'm aware of this, but unfortunately, we deal with some tragic situations here that we hope to make better. And with that, Jamie, I know we've got our guest up.
Welcome, and thank you for being with us for so long with Doc Talks. You've been with us since the beginning, haven't you, Jack?
Yeah.
All right, well, Jackie, let's get a little basics from you. Where do you live, first off?
Okay, I'm in Ohio.
You're in Ohio.
16 years old.
And I take it that you are a chronic pain patient, and what's your problem to give you the pain?
Well, I started in my 20s with herniated discs. Went on to be told I have fibromyalgia, then discoid lupus, then dysautonomia, POTS. I wrote you, I haven't got my disc to you yet. You suspect arachnoiditis, and then recently diagnosed with CIDP. The symptoms are hell. Besides the extreme pain, I have episodes of sweating so bad that my clothes are just completely drenched, heart palpitations, nausea, shakiness. And I don't know if these are like an adrenal crisis. That's what I'm going to go into. I can't seem to get any help from my doctors on that end. Right now I'm trying IVIG treatments, and so far those haven't helped.
Yeah. Let me go back. How old were you when you first got sick?
In my 20s, I started with back pain.
Started with back pain. Did the back pain just show up one day, or did you fall, have an accident? How did it happen?
I thought I injured my back. I'd been carrying a case of French fries. I worked at a fast food restaurant.
So
Yeah. They-
again, did you think you injured it by how? Did you fall or trip?
No, just lifting a heavy box.
Oh, just lifting a box. Okay. Now,
And
did you go to a doctor at that time?
yeah, and I was told I had a herniated disc.
And did they X-ray you at that time?
Yes,
They did X-ray it and said you had a herniated disc.
yes.
Okay. Were you operated on?
No. They
Operated.
suggested that I do injections. And shortly after I found out I was pregnant, so I didn't. Later on, it was suggested that I do surgery and that I would be up doing all my regular things within a week. I didn't believe that, and I haven't done a surgery. I've done RFA. I've done plenty of injections. I've tried ketamine.
They didn't help any.
No, I was told at one point that I had cervical dystonia, so I tried Botox to try to help with the pain. That didn't help. It made me worse for a while. And then I pushed for the connective tissue disease panel because I was suspecting Ehlers-Danlos, and I found out that I have a FBN2 mutation of uncertain significance. So they don't really know anything about it.
Did they say you had, I take it they said you don't have EDS?
No, it's a FBN2 mutation.
Did they say you had what's called, what they like to call today, hypermobile spectrum disease?
No.
Have you ever heard that term before?
Oh yeah, yes. I'm just by being in the groups and listening to what you talk about.
But so where did you do the test that told you had abnormal collagen?
Through invite.com, I guess. The Cleveland Clinic geneticist
Okay.
did the test for me.
So they did the test. So what did they say they were going to do for you?
Nothing. They just said it's a FBN2 mutation.
And what did they say that caused?
Uh,
I mean, did they think that had anything to do with your pain problem?
no, she just said that they don't have much information on it, that there isn't any much information available.
Okay.
It's a variant of uncertain significance.
All right. So now, do you go to a pain clinic now or a doctor? Or what kind of medical care do you get now?
My primary care physician poorly treats my pain.
What is your diagnosis? What do they say is the cause of your pain?
The arachnoiditis, CIDP, chronic inflammatory polyneuritis, discoid lupus. The back problems, they downplay the back problems now, even though I have compression fracture and herniated discs. Those are just wear and tear now.
They're just, is that an official diagnosis, wear and tear?
I have no idea.
It's as good as some of the ones I've heard. Right. So can you tell us anything about what you think you have or should do?
Pray.
Pray. Okay.
That's it. I've been going to doctors for 5 years trying to find out. I mean, well, I've been going to them since my 20s, but the last 5 years, I had an episode in April of 2020 where I was feeling run down. Possibly it was COVID, getting stabbing pains between my shoulder blades. And I can feel the inflammation from behind my head going down along my spine and into my hips. And it's almost like it's Charlie horses and bee stings. and I do have the neuropathy, but I can't differentiate what's what.
Uh-huh. Okay. Uh, do you mind telling us what you do for your pain at this point?
Everything. My heating pad is my best friend. Magnesium oil, plenty of different supplements.
Now, you said you were going to try IVIG. That's intravenous gamma globulin for those people that are not familiar with it. That's usually given to people who have low levels of gamma globulin in their blood. Is that your situation?
I don't know what the levels are. He
Are
did do testing that checked IgG and IgM levels.
And they said they were low?
He just says it's autoimmune, something autoimmune.
Something
And
autoimmune?
and he diagnosed me with chronic inflammatory polyneuropathy,
Uh-huh.
CRPS.
Okay. Now, have you had the viral test, the Epstein-Barr, cytomegalovirus, herpes 6?
I did, but I cannot tell who's doing the right testing.
Uh-huh. Okay. Very good. Dr. Ibsen, are you on here anywhere, Mark?
Here I am.
Oh, good. This lady sounds like she's kind of lost. You got any ideas for her?
Well, yeah. Prayer is effective, and action follows prayer. So at some point, you are a victim of a political campaign to deprive all of the pain patients in America from their therapeutic regimens. And it has now become a political and a human rights issue. And to some extent, that's where we need to attend to this. We've never been in a situation like this. I was just telling Dr. Tennant before the meeting that I had, I don't know, 7 or 8 calls today from people who've been abandoned. This public health crisis is accelerating, and it's 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 out of control because there are no controls in our system that guarantee us to get our pain treated. It's never been needed before. We don't have the infrastructure. You know, children used to starve, but now we have WIC. This is similar. Now, pain patients are in agony, but we don't have an agency to go to and say, I'm not getting my pain treated. We don't have an agency um, like the Justice Department to make sure that your doctor's office is handicap accessible. We don't have any of those structures, and we got to create them in a hurry.
The agencies that were supposed to be there for us that aren't doing a damn thing. Where are they, and why
They're
aren't
fighting
they
each other. Yeah, they're fighting each other, and they haven't got a common mission. But they have a common mission to eliminate opiates because they believe in this false narrative that pain pills cause an epidemic of overdose and death, and it's false. So everybody's believing that false narrative, and so we have to continue to tell the truth and scream it from the top of our lungs, which I've been doing for 12 years without a measurable impact. And so I don't have an answer other than the fact that the status quo is not acceptable. It's fourth world medicine, worse than third world medicine. And we have to get irate and up in arms about it, which is hard to do when we're in agony.
Are we connected still?
Yeah, I'm still here. I just out of
Okay.
words.
Oh. Well,
I know.
come.
Doesn't happen that often.
Yeah, it's possible that I had COVID 3 times too. I don't know if that has anything to do with this. Nothing to
It
do
sure
with this.
might.
But they don't even have COVID clinics anymore, do they? Didn't they just kind of go away?
Yeah.
Or never begin? Why are we being failed so badly here?
Well, I'll try not to answer that because my answer is I'm not 100% certain why we're in this mess. Okay? I do not understand what you're telling me, Jacqueline. I'm speechless. I mean, you're an adult, you've been to a lot of doctors. I mean, today we have MRIs, we've got blood tests, we can relieve pain. I mean, if we've got to make a diagnosis first. And you've had all these tests and somebody hasn't told you what they mean or what you can do about it. And that's not right. So I'm flabbergasted. I don't know what exactly to tell you to do. It'd be nice, but put it this way. You just can't treat pain. You got to know what you're treating. Okay. You got to know exactly where the pain generation is. Is it in your lower spine? Is it in your neck? Is it in your foot? Is it in your muscles? Where is the pain generating? And you got to know that. And the fact that you may or may not have these things, it just doesn't make a lot of sense to me. And so I don't have any good idea, except I start trying to find out from your doctors what they mean. The fact that you may have viral tests, you may have had this or that. You've got to pin that down. I think that's the first thing you have to do. You've got to have the symptoms, plus you've got to have the tests, and a doctor then willing to give you what you need. But it sounds like you've got an autoimmune disease, and you're not going to just relieve that with opioids. You're going to have some other medications to try to work, and that's all I can really tell you at this time. Right.
The only other thing he's prescribing is 10 milligrams of prednisone every month to go along with the infusions, because I was getting sores on my face and scalp.
And what was the sores from?
I'm guessing from the IVIG, but maybe there's mast cell activation going on, but
Yeah.
my doctor doesn't seem to deal with that. The immunologist, allergist I've seen doesn't deal with that, so I have no idea.
Yeah. Well, IVIG is a very expensive treatment, so I guess is that they've got a diagnosis of some autoimmune disease for them to obtain the IVIG, and it does help in some cases. So, Jacqueline, I'm not sure we've been of any help to you, but you certainly illustrate something, as Mark has just said, is terrible out here in the country. Our prayers will be with you too. So,
Could you tell me if these sweating episodes with the heart palpitations and the shakiness, does that sound like an adrenal thing, or?
let me put it this way. When you talk about all the sweating you have and what have you, certainly hormone deficiencies can cause that. Excess pain can cause it. Temperature going up can. There's any retained electricity. There's 3 or 4 reasons why you could have that. But again, it goes back to, you got to know a little more on what your basic problem is, because as you know, you've had it and you've had it a long time. So that's about all I can tell you at the moment. Mark, do you have anything else for this young lady?
I was just looking up the diagnosis of CIDP, chronic inflammatory demyelinating process, or polyneuropathy, and it looks to me like it's a reason to try Vyvgart Hytrulo, which sounds like an expensive experimental treatment that has side effects of respiratory tract infection and headache and urinary tract infection, etc. So it's I'm going to tie the diagnosis to the expensive treatment for it, and that might be one reason that you'd get that diagnosis, is so they could sell that to your insurance company.
Yes, and I was able to get on, which I'm grateful for, to get on their patient assistance program to cover
Did
that,
it help
because I
you?
sure can't come up with $15,000 a month. No, not
Right.
so far. It's been
Did
5
it? It
months.
hasn't helped. Yeah.
So,
So, you know, often in medicine, you know, we make a diagnosis in order to create a treatment plan for you, and you know, without a good diagnosis, we can't develop a good treatment plan. But that was in the days when we were left alone, the doctor and the patient, to create a treatment plan together. And obviously, we are not left alone to create that plan for you anymore. It's basically, let's give her a diagnosis that's really expensive, that we could treat her with a very expensive drug, and maybe that'll help. But we're not going to give you an opiate that costs pennies. That is beyond me as to why that's happening. And you know, you should definitely be on opiate therapy, obviously, and to document that the opiate therapy is helping you by moving around in your life, or getting stuff done, or getting on the floor with your grandkids, or however we assess function. And the best person to help with function is the people who love you, go to your doctor's office visits with you, and say, Jackie's not functioning. What can you do to help her function? Actually, give us a way to create a life that's worth living. You haven't got that right now, correct?
Correct. And in the
Yeah.
ideal world, we have somebody to go with us, but a lot of us don't have anybody.
Yeah.
So we can't.
Right. And so under those circumstances, you can maybe record your visit and share it with somebody else. I get what you're saying in an ideal world, but this is certainly not ideal. An ideal world would have you treated and able to participate in your life, and then look for a diagnosis that's more palatable to somebody. But right now, with the national narrative that everybody's so terrified of badness to have to their own license, pharmacists, doctors, etc., we're not getting, the patients aren't getting what they need, and we have to be screaming that from the rooftops. And I don't know how to scream it any louder than I've been screaming.
Very good. All right. Well, thank you so much, Jackie.
Thank you,
I'd like to say, I hope you make some headway, and God love you, and good luck.
Thank you.
Amy,
Thank you.
Hey,
I have for a long time been watching and been a supporter of the FLCCC. And I think I talked to Dr. Ibsen about this a little bit. They have created an organization to promote honest medicine and preserve the doctor-patient relationship. They have doctors worldwide under their umbrella. They've mostly dealt with things that are marginalized, as like sepsis treatments that doctors were getting persecuted with using vitamin C, or treatments for COVID that were repurposing old drugs. But they have successfully banded together and fought back against, they've won lawsuits. They got the FDA to take the false there was an advertisement about ivermectin that was inaccurate. They got them to take that off television. I think, and I believe, and I hope if we could get under their umbrella, they might give us some resources or some support, where we're not just a small organization, but we're also under the umbrella of these doctors who have also been persecuted for trying to practice honest medicine. And they have a really nice new brochure. And it's like their integrity in healthcare, empowerment to knowledge. They want to make the patient-centric decisions, inform the latest unconflicted research, and to establish independent direct care practices beyond bureaucratic interference. So, I mean, there are things that we are talking about here that they're actively trying to do in other fields. And so I don't know if the doctors among us can try contacting them. I mean, I sure could, but I just feel like maybe there's a home for us there that will give us more power and more of a voice. And especially if they knew of our plight, because I think they have a lot of heart. You know, they care a lot, and so I just have to say something. I'm not sure how to connect us. But they have tons of research and really interesting things that they're protecting doctors. You know, like Dr. Tennant, your research is so new and forward thinking. I think they would embrace that and support you, as they are with Dr. Merrick, who's doing this, you know, experimenting with different treatments for sepsis. And they have all these different groups under there that are trying to, you know, advance new medicine that doesn't make a lot of money. But, you know, so I just really, I just feel like we need more power, and this might give it to us. They have a website, the FLCCC. Was the Frontline COVID Care Alliance was the first thing that they came out during COVID, but they've kind of expanded.
Do you have an address or somebody that you
Yeah,
can...
if you go on, I mean, if you
I
go
just
on,
sent it to you, Dr. Tennant. I just sent it to your email.
yeah, it's flccc.net. And yeah, they have a huge website. You can look at tons of videos about people whose lives they saved. They have links to their research. They have links to protocols that help people. They have post-COVID protocols that help people recover. And so, yeah, so if I can be involved or help in any way, but I just really think we could use their umbrella to help us with our, what we're trying to do. I think we fit right in with their direction and their main thrust of what they want to do. So
Excellent. Thank you.
Yeah.
Yeah. Mark, do you have some other comments you want to make about anything? And I've got one small thing I want to close out. Thank you very much on this. Okay, yeah, I agree with you totally. And I want to come back and make a comment about it in a second.
Okay.
Yeah, Mark, what else can you tell us about the situation and whatever we can do?
So I have a video to share about what a pharmacist had to say about one of my patients. And I'll turn that up.
No, I said I was concerned that the dose she was taking, she did like almost 9 times the risk for an overdose. I'm aware she's been taking the medication since she was 12, but none of us here at the pharmacy feel comfortable about doing it. I've asked her about her treatment. She said she was going through Dr. Bennett. Dr. Bennett was not giving her any pain.
A rheumatologist.
So she turned to you.
Right.
We've been telling it probably since August or so, and we've told her all along we're really nervous about the fentanyl medication. We've done it up to this point.
So you're not even going to allow her to be tapered. You're just going to cut her off.
Well, she said that you're going to taper going from 1 or 2 every 3 to 4 hours to 1 every 3 to 4 hours, which, to me, that's not much of a taper. I don't know.
Well, she has ankylosing spondylitis. I mean, it's a painful condition.
Well, I know what it is. Why does she have to come here? I've done the best I could do for her.
Why does she have to come here?
Got it. I got it. All right.
Okay, thank you. Why does she have to come here? This is a pharmacist who's feeling sorry for himself that the patient has to come see her. So that would be like a pilot being on an airplane saying, why do all these passengers have to be on this plane? or your mail carrier saying, why does people have to send Christmas cards around Christmas time? It's just like stunning that you could tell that guy, he's got a gun to his head. Somebody is holding him hostage. This is why we can't be treated, because he's not admitting who's holding him hostage, and he's embarrassed about it. And he's just saying, oh my God, I wish this problem would go somewhere else. Well, there's 100 million of us. We're not going anywhere else except to the morgue. And we've got to begin to declare and show this kind of malfeasance on the standpoint of people who are taking care of patients who took oaths. There's a pharmacist oath, and it's a little different than the Hippocratic oath, but I mean, his oath is to be of service to the patients that he encounters. And it's a privilege for him to have that role, and he belongs furloughed, like get him off the front lines. If that guy is that fried and that frazzled, bring in a substitute, bring in somebody else. And I think that's kind of part of the problem, is the whole pharmaceutical industry is overworking all their workers, and they, like medical workers, don't have time to even straight, flooded with people who can't get their needs met. And it's a moral injury to be a professional and not be able to profess your patients. That's all I got.
Well said. Well said.
Jackie, did you have anything else that you wanted to add at all? I can't think of anything I can add. I think you covered everything. You did a great job.
Just trying to figure out what these episodes are.
Trying to control those episodes, and
because I kind of can't even leave the house. I gotta kind of wait for one to be over and try to get to the store.
Right.
If I can, and just hope I don't pass out in the store during it. And I don't know that it's a POTS thing. I don't know. POTS dysautonomia. I don't know that it's that or not.
Right. So I was going to ask the docs if they had any suggestions in any further testing that you might need.
Even on absorption, I don't know that I'm absorbing anything right, because muscle relaxers, I don't feel anything from them.
Right. And you are an
Mhm.
ultra rapid metabolizer, right? Do I remember that correctly?
Yeah,
You are you're a rapid metabolizer?
but it doesn't change the dosages on anything since I found out either. And I don't know, you know, I don't know if it's a problem of the dosage or if it's just me or.
Well, let's come up with the new diagnosis. Let's call it CRPS, chronic resistance to appropriate pain treatment. let's find some viral conversation. And I'm sorry about the laughter and the gallows humor here, but we gotta find something that can captivate our our colleagues and our other citizens, that we have a human rights and civil rights as well as medical rights problem going on with people who are being abandoned. And it's a perfect storm that some of the evil people who feel that pain treatment must be bad, and we've just got to have more dialogue and more information and less disinformation, and an active program against the disinformation that everyone is experiencing. This is a fundamental human rights problem as far as I'm concerned.
I'm writing that patient abandonment on my car windows. I'm getting yard signs. I don't give a damn what people think about me. They want to ask me questions, go ahead. They can ask me all they want.
Exactly.
Talking, you know.
Me too, darling. Me too. I'm available. I'm overwhelmed, but I'm available. I don't know how to. I was talking to Susan about this earlier today. There's one great theme about our situation, and that is that God doesn't choose the qualified; He qualifies the chosen, and we are the chosen. So we're the ones that are chosen to deal with this issue. It's not fair. It's not right. It's criminal, etc. But we're the ones that have been chosen because we're the ones with the illnesses. So, it's time for us to get really pissed off and maybe get some power and some energy from that. That's what I always do, is I get energy from my anger. But it's like Carson just said it. We are the martyrs, and we're not going to let them martyr us. We're not going to kill ourselves. We're not going to go quietly into that dark night. We're going to scream loudly until our needs are met, and that's going to require louder screaming than we've been doing. And eventually we'll get a video that'll go viral, or some influential person will have chronic pain, and and some other influential person other than all the ones who already have it, and eventually we'll get some momentum going. I think we're that close, but we must not give up. That's the thing. I feel like giving up every day, and then I hear your story, Jackie, and it's like, no way am I giving up. You are not alone. I can tell you that.
Feels very lonely.
Yeah. Well, this is a motivator. Let's look at it that way, everybody. What we've heard here should, number one, be a motivator for us to keep going and resolve some of these problems. And admittedly, Jackie, I don't have answers that I'd like to give you. I know Mark doesn't, no one does. So hope God love you. Come up with some of your own. Just keep going. That's about all I can say. I'd like to close this out by a comment that was made a while ago. You think the medical system is bad. The research medical system is in worse shape. It has totally, almost disappeared in the United States. I started off my career as an Army surgeon during the Vietnam War, transferred from there to UCLA and did my research out of UCLA for many years, and was editor of a journal. I've published a lot of papers. And what's happened in research today, it has been decimated as far as the government, the universities, and the pharmaceutical companies are interested in that one big thing that they can make a lot of money on. So I and some of my colleagues have formed a foundation, because if private doctors today and private clinics don't not only do the research, but publish in books and do like this podcast, it won't be done. Anybody who is sitting here thinking that the United States government, some university, some famous institution is going to save you, it isn't going to happen. If you go back in history, you'll find that a good percentage of the famous discoveries were done by doctors like Dr. Addison, the famous Addison's disease. Took his 11 cases, put them in a nice book, and wrote a little book. He was kind of an inspiration to me, so that's why I do it. So when you mentioned, I'm going to keep up with the research and keep trying to come up with new things. But again, the current medical system in the United States is research adverse. They are not interested, the system, in coming up with anything new because it's all based on paying big money for universities, pharmaceutical companies, insurance companies, government agencies. We've got 340 million people in this country, and it's become a total financial mishmash, and research is left behind, except some of us are going to stay in there doing that too. So I do want people to know that there's research being done, but it's being done and disseminated different than it was, let's say, 20 years ago. So with that, we'll close off again. Remember, we've heard some sad things tonight. A lot of us are not happy about all of this. That's a motivator, folks. Stay motivated for this next week. Let's have a good year and do something. We'll see you next week.
Thank you so
Good night.
much. Good night. Thank you all so much. Have a good night.
Good night,
God bless
everyone.
you.
Thank you so much.
You're not alone.
Good
Thank you all.
night.
Thank you, everyone.
Thank you.
Happy New Year.
Happy New Year.
Happy New Year.
Indeed.
Good
Yes,
night.
indeed.
Happy New
I'm
Year,
grateful
everyone.
for all of you.
Thank
Let's be
you.
grateful for each other.
Back at you.
Thankful for
You
you,
too,
Dr.
Dr.
Ibsen.
Ibsen. Thankful for you too, Dr. Ibsen.
Jesse
Hang
Jackson.
in there, Jacqueline.
Thank you, everybody.
Praying for you.
Hope alive.
Happy New Year to
Jesse
y'all. Main
Jackson.
warriors,
Say
we
that.
cannot
Keep
give
hope
up.
alive.
Because we
Yeah.
are warriors.
That's right.
Nice fish,
Night,
Brandon.
y'all.
Bless you. Love you.
Love y'all.
We are the
Night.
island of
Thank you
misfit
all.
toys.
Love you guys.
Love
Thank
you
you.
guys.
Great first episode.
Thank you,
Yes,
guys.
it was.
Love you guys. Happy New Year.
Happy New Year.
Mwah.
Happy New Year.
Yeah.
Mwah.
Love y'all. Good night.
Night. Love you too. Good night.